And how, I mean, I think one of the things I also want to dig into here is how have you guys been finding talent? And what was happening to that talent as you were onboarding them or during a retention period? I mean, I think from our discussions, I understood that onboarding and retention are as big a challenge as even finding trained staff.
Yeah. So, I mean, I feel like this is a common theme when we talk about healthcare. COVID changed everything. And so a lot of what we really focused on internally was focusing on retaining talent. So what can we do to make sure that the people that we have, knowing that not a lot of people are going to be willing to come into the healthcare space during a global pandemic. So how do we keep the people that we have? So as a system team, we did a lot of investment into looking at what our career ladder looked like from a pharmacy perspective. So we had different levels of technician when I got here, but during COVID, we took a lot of times and said, all right, how do we retool this to at least give some upward mobility for the people that we have? So we did a lot of work to develop different levels within our technician team, anywhere from a technician 1 to a technician 4 to leadership positions within our technicians. But what we were seeing is we weren't getting anyone coming to us. And I think that was the challenge that we were seeing. So we did a lot of work and we did a lot of great work to keep the people we had to maintain the lights on and keep the operations running. But we weren't getting anyone in to bolster up that team because we were still running vacancy rates of 10, 15% consistently and just making them do it. So what we did is we started an entry-level technician position and we started to push and recruit. And so all of our technician positions at the time before creating the entry-level position required certification from a board, the Pharmacy Technician Certification Board, which for us was good because it made sure that we had at least higher level competent people that were working within our team. All well and good, but we weren't getting anyone more into the door. So creating that entry-level tech position was key for us to start attracting people from other areas within healthcare or people that were willing to make the jump to healthcare that may not have had the experience. The challenge was those people did not have any experience. And so without having the experience, it was a really difficult time trying to train people who had never handled a medication before, had never been in a hospital setting, had never even seen medications before, to say something as simple as, we need you to go take this controlled substance to the floor and recognize that with controlled substances, there's a lot more rigor that's associated with it. And it's not the same thing as something that you get off the shelf at a pharmacy. And so that's where we really started to see the gap. And so we started to think about, well, we really have to limit the number of entry-level positions. Well, at the same time, that's when we started to have conversations with Cengage and about their training program. And so what we saw as for us is a great meld of what we were looking for, but also the opportunity to train team members up to a level that they could get into the door, start working, get the education needing, but then could be a contributing member to our workforce that took pressure off from our other technicians from day-to-day training, from our leaders from having to go and provide handholding and doing that level of education, which we didn't have the resources to do. So partnering with a company that provides that didactic training for our team members really set the stage for us to really grow that pipeline from outside of our current healthcare setting to really bring people into our team and then get them into that career ladder so that, yes, everyone can go get a job in retail. You can get jobs. You see things advertised. Amazon's paying higher rates than normal all through COVID. But a lot of times that's your cap. You start at the same level that you're going to be at. What we want to do is bring people in and see that there's a career, that if you put the time and energy in, that you can make each step within the program as you start. And we support our team members to be able to do that.
Yeah, I think so. And I think that is one of the amazing promises of healthcare is that career ladder. And we see, I mean, one of the things I was so impressed with, Mike, when we first started working together is that you had already built it, right? So you guys were ahead of where a lot of people are going. And I think that is a great example.